Hi, thank you for joining. I'm Bernie from the BOB.health team, and this is a briefing presentation for NHS staff considering BOB.health. We want to share with you what you can expect from both Bob and the Bob team, as well as explaining a little bit about who we are. So, in response to the COVID-19 pandemic, you are making changes to the way you work like never before, and you and your colleagues are being absolutely remarkable. You're doing everything in your power in the best interests of patients. In normal times, it's hard to discover the experience and practice of other people who have done something similar in a local setting. And right now, it's almost impossible to find out how colleagues in other parts of the country are adapting and evolving services in response to national guidance. So Bob is here to support you. Bob is a supportive online tool for NHS staff to share the experience of adapting local services in response to COVID-19. It's free for NHS staff to create, learn from, and share. And big changes, such as changing a whole service, are great. But so are the small things, tiny adjustments that you and your colleagues have worked out. Both are equally valid, and Bob helps you record them quickly. So Bob helps share how you've made a local change happen so that others can learn from it. But a question you may have is, why Bob? Well, when starting an NHS project, big or small, NHS staff find it hard to discover the experience and practice of other people who have delivered something similar. Bob is the person in the organisation that's been there for 9 years. They have institutional memory, and they're the person you go to and ask, have we done something like this before? You may even be the Bob in your team. So pre-COVID-19, our focus was profile improvements on the ground and introduction of innovation. We were set to launch in mid-June this year. Here, NHS staff could capture what we're calling impact stories, and impact stories unpack the how-to missing in traditional case studies. Our co-founders started working full-time on Bob in January 2019. They raised investment for the concept, and the core team of 6 started to work together last October. We're also working with some fantastic developers, some expert freelancers, and 21 Bob ambassadors of volunteer NHS staff. Our NHS collaborator is Dr. Jill Bailey, and her team are Oxford Health Improvement, a group that is part of Oxford Health NHS Foundation Trust. Dr. Bailey has been the most tremendous collaborator and continually supportive of our approach throughout. There are also 15 academic health science networks, or AHSNs, across England, and these are established by NHS England, and this was done in 2013 to spread innovation at pace and at scale, and these aim to improve health and generate economic growth. So each HSN works across a distinct geography, serving a different population in each region. Susie and Rob are from 2 different AHSNs, but both have provided ongoing advice and fully support Bob.health and our efforts to support the NHS staff during COVID-19. So, up until March 2020, we'd made lots of great progress with Bob's development, and we're planning to launch in mid-June. So, we'd found 21 Bob ambassadors who were brilliant. We'd co-created Bob with these NHS staff to make it a learning hub that the NHS deserves. And we'd also crafted a writing engine which asked a series of precise questions around making change happen. We'd started gathering stories of general improvement, and finally, we'd established a sales process to generate revenue from NHS suppliers to enable this Bob tool to be free for the NHS. So stories of innovation introduction that benefits both patients and brings value to the system could be shared. But as we saw the impact COVID-19 was having in Italy, we wondered, could helping NHS staff to tell and share stories of making local change be useful at the moment? However, would NHS staff in a crisis situation have the bandwidth to even think about sharing and learning on top of responding to COVID-19 on the ground? So, overnight on the 16th of March, we polled NHS staff through a social media campaign that we distributed across our different channels, and a survey that we put out to them found that 96% found it would be useful to hear how others are responding to current changes in other localities. And also, despite mounting professional and personal pressures, an astounding 62% of you would find 1 hour over the coming months to share your learnings about how you're responding to COVID-19. So the need was clear. So in response to this genuine need, we've moved fast. We've compressed a 12-week work programme into under 3 to realise this opportunity and make a real difference. But we aren't naive. Even though 2/3 of you said that you dedicate this time to share, we understand that for this to be possible, we really have to make it as easy and quick for you as possible. And we need to make the process of capturing your impact story as smooth as possible. So this crystal focus on COVID-19 has meant that our focus is now solely on helping NHS staff create, learn from, and share the experience of others in evolving local change in response to COVID-19. The other modules will return, but for now, we want to fully support you with your tremendous COVID-19 efforts. So let's get back to the supportive online tool. We fully appreciate how much pressure you are under, putting patients first like never before. We also know that to share, our process needs to be made as easy as possible, and Bob's writing engine makes the otherwise daunting task of telling your story easy. I'll run through this journey with you in a moment. In under 60 minutes, you can create your impact story, and this will help someone elsewhere in the UK looking for a helping hand at a time when shared learning is especially important. As well as reading content, we'll also actively encourage NHS staff to share impact stories they found useful within their professional networks. And our Bob makes it easy to showcase relevant content. So Bob has been created with NHS staff like you. And this has always been the case since day one. Our mission has always been to build a supportive online tool that the NHS deserves. So this has been in line with our ambassadors who work in quality improvement, medicines optimization, behavioural science, and include doctors, nurses, allied health professionals, as well as expert storytellers. Our insights that we've had from the HSNs has been really helpful as well, and part of this has come from the adoption of their framework that has helped shape Bob's structure. NHS staff workshops and user testing have also further refined the tool to what we have today, and you can see there some images from one of the workshops we ran with some of our wonderful ambassadors. So back to the COVID-19 module now. So our knowledge of the questions needed to capture general improvement and input from the frontline staff on COVID-19 change have really helped here. There's also been ongoing review and feedback now and in the future from NHS staff Bob ambassadors, and we're also welcoming organisations, any bodies, NHS staff, to make any suggestions or raise any questions that they have and features that would make Bob even easier to use. So we know now more than ever, stories emerging from the NHS will be emotive. We also know that NHS staff will always make change happen in the best interest of their patients. So we're here to support you in this journey of sharing. A member of a creator senior team or professional body will also be required to sign off and approve your impact story ahead of publication on Bob. And this helps make a really safe space where you can trust the content that you're seeing out there. This is also backed up by our dedicated quality manager, Nick, who's built her career in the NHS, and she will review every impact story and make sure that it aligns with kind of guidance protocols and Bob's own internal protocols. And importantly, Bob can only be accessed by NHS staff and HSN networks and other verified and approved professional bodies serving our NHS. So let's have a look at Bob's supportive online tool. Here you can see the specific COVID-19 module where NHS staff can either share or learn from impact stories of others. So this is the journey of creating and sharing an impact story on Bob. So we go from creation through to approval, Bob quality review, publication, and then of course sharing. So our writing engine makes the otherwise daunting task easy by sharing a series of precise questions around COVID-19 stimulated change, drawing out insights to create a compelling and authentic read. You simply answer a series of structured questions which will ask you about the change you and your team have made. We work both with the creator and sharers of impact stories, but we also want to make sure that we equip the reader with the practical how-to needed to implement similar changes in their local setting. So just bear all of that in mind as we go through, that we've done everything we can with our BOB ambassadors to make things as easy for both the reader and also the sharer. So the first step is to build your narrative. So when we say narrative, this is a really short and sweet section that showcases and highlights your work. As you can see here, so we've got build your narrative, add core details, embellish your story, add declarations of interest, and note any professional body memberships. So if we go through now these here, so the narrative would be the first point, and this is kind of a snippet that you do to kind of get people engaged with your content. So this would be a short summary of your project. So next is the core details section, and you think about this as kind of like the body and the bulk of your impact stories, and your answers here will be quite comprehensive. To help with this, there'll be simple prompts and Bob's narrative starter boxes, and these give an example of how you could start each question if you wanted to. And also, depending on the size of your change, you might want to choose the most relevant questions to answer here. The next section, embellish your story, is where we really delve into the finer details of projects. But we do appreciate that with the demands placed on you at the moment, that some creators might want to skip this. So it's optional, you can come back to it post-submission when you have a little more time. So next is approval. So we're here to support you on this journey of sharing. Our system will help you get the sign-off from a senior staff member in your workplace or someone directly employed by your professional body. So you can kind of see what this may look like once you do submit it, and then it goes into pending approval. As I mentioned earlier as well, our dedicated quality manager, Nick, who has built her career in the NHS, will check every impact story from Bob's side. Here she might suggest including some official guidance, protocols that could help your readers. So then once it's approved, it will go live. So this means that that snippet in the narrative of your impact story will be publicly available. In other words, the title of your project, a sentence summary, your name and organisation will be available in search. On reading this, only NHS staff will be able to sign up to Bob for free if they aren't already signed up, and they'll be able to access the full impact story and discover any other further stories of interest. So as well as reading content, we'll also actively encourage NHS staff to share impact stories they've written or found useful within their professional networks. We'd also love to let professional membership bodies and employees know about an impact story and share links to impact stories on Bob's social media channels. That way, ideas and insights from people's practical changes will help spread more quickly, resulting in shared learning. In both instances, however, we appreciate that change makers may not want their name mentioned. So when we contact bodies and employers or share content on social channels, we won't mention your name unless you mention it. We'll focus on the great ideas rather than naming our change makers. So rather than saying Dr. Joe Blogs has introduced a virtual consultation setup, we'll say a GP has optimized setup of virtual consulting, and read more about it here. So our values really matter to us. BOB unites NHS staff, NHS organisations and NHS suppliers to help liberate proven good practice and experience from institutional silos across the healthcare system and drive mass adoption. As we're working with motivated people at the grassroots in the NHS, social care and private sector, our values are really important to everyone at BOB. We're kind, we're resilient, and we're collaborative. The last value, though, is one that I'd really like to focus on, and that is trustworthy. We do what we say we're going to do for our customers, collaborators, and each other with integrity. So we know you're busier and under more pressure than ever before. For BOB to be of most use, we need your stories. Have you implemented a change in your area in response to COVID-19? Perhaps you're a GP who's coordinated the rapid introduction of remote video consultations. Or maybe you're a pharmacist who's found a way to adapt in pending drug shortages. No matter how big or small the change, this is really important, sharing your learnings at a time when collaboration is key. So if you've made changes to your local service, tell your story. It will help others in a similar situation in the UK. So I hope this whistle-stop tour of Bob has been helpful for you. Visit Bob.health to access our free supportive online tool. We've designed everything to make it as easy as possible for you to tell your story. And we also realise that the tool won't be perfect in the 15 days that it's taken to create. So we're all ears if you've got any ideas of things that could help make it even better work for NHS staff. So to all of you in the NHS, nurses, doctors, allied health professionals getting the NHS through one of its toughest times, we are incredibly grateful. Take really good care of yourself and we look forward to hearing from you. Thank you.